muscles, so they would tend to move the scapula. You have your trapezius. So trapezius, you have the fibers, the upper, the middle, and the lower. Okay, with regards to the upper fibers, face na po. Okay, with regards to the position of the upper extremity, patient can either be in prone, supine, sitting, or standing. It's up to you, whatever what you want, but as long as comfortable ang patient, accessible yung to palpate the structure, o pwede siya in that position here. So, for your trapezius and with regards to instructions, you have to always tell the patient in layman's terms. In layman, instruction or commands in which common people can understand. Not medical terms like, sir, I want you to flex, I want you to extend, but they cannot understand. And then also, with regards to instructing your patient to contract the muscle, there are times probably sagot ang patient, sir, ipa-contract yung muscle. So, we have to use a layman's term like, sir, I want you to harden your muscle. Try to harden or pagkahiya ang muscle, sir. Or paliho ka ang muscle or harden.
Pwede ba kaya, sir?
No. Oh, you have to do more English with that. Rather than Bisaya. There are times that even we're going to ask the patient ipa-harden ang muscle, mag-isod sila harden. So what you're going to do, or the contract, is you can place slight resistance so that mas maka-feel na ni-contracted ang muscle. So when you say resistance, you just have to oppose the action. Like for example, bicep brachii, bending the elbows, you just have to resist that, oppose it, or ang imo lang resistance will just always be opposite to the direction of the motion. Pa, slight, when there's slight, then palpate. Okay, mas mo contract ang muscle if there is resistance rather than without. Okay, so upper trapezius, sir, I want you to move your arms forward a little bit. One arm na. See, one arm, a little bit further, go up, sir, up. Okay, hold. Okay, sir, what you're going to do here in that position, sir, I want you to reach your hand here towards the post or towards the wall. So, layman's term, try to reach. So, ano siya? Crack. So, if you want to resist, you can resist it this way. Oh, for choose of partner, you try to practice. Correct. Try to practice on your own. Resist that one by going downward and palpate it here. Okay, there. So, palpate it there. So, upper trapezius. So, just have to move it upward. Okay, upward, right to reach. Okay, there. Ayan. Okay, so that would be for your upper trapezius. Okay, for your middle trapezius, so as the patient, sir, I want you to move your arms sideways. And then there, okay. Okay, sir, so what you're going to do, I want you to move your arms backward. Move it backward. Okay, then, so while nag-start the patient of move, pwede na mumuhang o resistance. Palpate it here. Okay, move backward there. And palpate it there. So, ganyan siya ang middle fibers. Wow. So, you ask the patient to move the arms backward. Yung ano ang scapula. So, pwede siya mag-ahit. Okay, next, your lower fibers. So, lower fibers. You ask the patient again to move the arms forward. Press upper traps, but lahi na ang action. Okay, sir, I want you to depress your shoulder or move your shoulder down. Ano siya? So, paano siya? Pa-adjust or move your shoulder backward. Siya. Pa-depress. So, there, mali siya ang pass. So, you're going to, your resistance will be going up. So, you palpate it here. So, lower trapezius. Back. So, back. Yan siya. And here. Back. So, that would now be your lower trapezius. Back. And next, for your liberator scapulae, so you just ask your patient, sir, I would just want you to shrug or raise your shoulder up. Raise your shoulder up, resist that one, palpate it here. A little bit side sem trapezius. Trapezius ba niya, upper traps, so a little bit here. So So you have your levator, scapula. Okay, next, your rhomboides minor of major. So as a patient, sir, I want you to place your hands at the back and try to move it backward. Ang imong head. Imong head. Ano head. Then palpate it here. Medial borders sa scapula. So you can resist that one by pushing that one. So move. Okay. So move na siya downward. So maganda na siya. Tama na. Then there. Palpate it there. Resist na siya. Resist. Here, resist. Sige, move. Okay, so you have your rhomboides minor of major. Okay. Next, your serratus anterior. Side view. So, sir, I want you to place your arms forward. Yeah, that's the bell. Okay, sir. I want you to try to move your arms forward. Move your arms forward. Then palpate it here. Okay. So, you have your serratus anterior. Move you forward and resist that one. So, you move forward, resist, and palpate it here. Matutulong sa serratus anterior, diba? There. Back. Okay. So, those are your mga scapular muscles. So, have attachment towards the scapula that moves the scapula. Now, next, let's proceed now to those muscles having attachment to the humerus. So, it will enable you to move the humerus. Okay, first, you have your pectoralis major. Sit down. Here come sit down. Okay, so pectoralis major, as the patient is, sir, I want you to place your arms forward. One arm, pwede lang. And then, move this arm towards your chest. Horizontal. Move your arm towards the chest. And you can resist this one. Resist. Move. Palpate it here. Or you can ask a patient, sir, I want you to approximate your hand there and put a pressure on both hand there na siya with using this arm, sir. Place a pressure there, but wait it here. Gahi na siya. Here, back. So, ano? Inundot oil then. Here, relax. Okay, with regards for the females, so you're going to palpate this muscle above the breast or above the nipple. Dili, underneath the drink. Why, palpate yung sa muscle lagi above the drink. Okay, kasi ni practical, diri niyo palpate yung elbows. So, diri siya, above na. Okay, so that will be for your pectoralis major. Ayan. Okay, for your latissimus dorsi, pwede nyo siya in this way. One, okay, sit down here, sir. Okay, sir. So I want you to try to lift your body, hold your body, or lift your buttocks up by pushing towards the plit. So by pushing your hand towards the plit. So lift your buttocks up. Sige, lift, sir. Nilift niya, you just so palpate it at the back. Or ingani nga po. Face na ba, sir? And place your arms here. So what the patient will do, so you can instruct it, sir. Try to place a pressure on my shoulder or try to put a force on my shoulder. So put a downward force towards my shoulder and after that palpate here at the back. Okay. Pwede niyo i-guide ang sa'yo. That will be for your latissimus dorsi. And next,
interview na
you have your deltoids. So deltoid din siya, deltoid, pwede siya. Okay, so what you're going to do with your deltoids, so anterior fibers, you just ask the patient, palpate it here, and ask the patient, sir, I just want you to move your arms forward. There, palpate it and you can resist that biting. move lang yun, sir. The resistance by placing a resistance, putting it downward. Ano siya ang anterior deltoid. Naka-feel ni kahit anterior. Back. Okay, middle deltoid. So just as the patient, sir, I want you to move your arms sideways. There, there's resistance there. When you move, palpate it here.
Amazing lagi
That
niya.
would be
Diba?
now
Lagi
your
niya. Ako naman
middle
sa
fibers. Back.
Pasan sa kumang kas. Ako naman feeling sa balik.
Okay, for your posterior fibers, stand up again. Posterior fibers, same position, same middle flexor. I would want you to move your arms backward. So scapular and the palpating you would be here. You can resist as you move back there. So palpate it here. Feel back. So pwede while nag-start siya move, yun nag-resist and palpation would be here. Back. Diyan sa imong gland on your blood joint. Ganyan siya. Relax. So that would now be your middle ulna. Okay. Next, supraspinatus. Posterior deltoid ha. Okay, supraspinatus. Okay, sir, I want you to again move your arms sideways. There, resistance again. Pwede na. When I-start your motion, you move further, you move. Then, you're going to palpate here above sa spine, sa scapula. Above the spine. So, you have your supraspinatus. Okay, your supraspinatus. Okay. Relax. Okay, next, your infraspinatus. So, below the spine. So, what would be your action is you can ask your patient, kay external lateral rotate, pwede niyo may resist there, sige move laterally, or you can have it in this way, and then a position kay lateral rotation mo na siya. So, imo na, kay hold her, or so, I lang kayo pa-move. Don't let me move your hand downwards your hand, just maintain that one, palpate below the spine here. So, magahin na siya. There. Back. So that would be your infraspinatus below the spine. Teres minor would still be below, further below, still same action gap, but here. External rotation. Back. External rotation. This medial rotation, external rotation. And discuss naman yung Sir Don by the way no, same motion. Would expect. Let's say medial lateral rotation. Yun na. Every fine. Okay, next. Your subscapularis, so internal rotation mo siya. Either internal or paana internal rotation. So, or paana internal rotation. So, sir, I want you to move your hand downward. Okay. Downward move that iris is going up. And where are you going to palpate it? I don't care. Towards the axilla. Subscapularis man, diba? You have identified sa kuan. So, dito niyo insert so sa axilla there. One there. Here, that will be your subscapularis. Internal rotation action resist. Kaya na. Okay, next.
Kalito na yung patient. Kalito na yun.
Okay, we'll finish on those muscles for the humerus. So, having attachment or would be able to then remove the humerus. And I proceed now to those muscles responsible for moving the elbow. Or having attachment sa forearm. Okay, first, you have your bicep brachii. Ayun ang bicep, di ba? Sir, I just want you to bend your elbow. Supinated ang forearm. Bend your elbow. Bend. Resist that one. Kanya siyang lahi. You have your bicep brachii. Okay. Brachialis. So, you just have to ask your patient, pronate ang forearm. Then ask the patient to bend the elbow. Pronate, sige, bend sir the elbow. There. Right. Kumana siya. There. Okay, bend the elbow. Sure. Okay, there. So, pronated. Okay, next. That would be for your brachialis. Next, for your triceps brachii. Okay, for your triceps brachii, you just ask your subject, sir, I just want you to straighten your elbow. From that position, you straighten it. Straighten. Extensor. Straighten na yung elbow. And you're going to have isa here. So, pwedeng supine or in this way. Okay, sit down. I need another chair. Pwede rin natin yung forward. Better. Kaya. Okay, you can have another chair or what? Yes, a bed. Okay, sir, I want you to straighten your elbow. Then palpate it, straighten, straighten, then straighten, straighten. So that's how you're going to palpate. Okay, so straighten the elbow there. Palpate. So that will be for your triceps brachii. Any questions so far? Okay. Movement still for the elbow. You have your... Okay, your brachioradialis. Brachioradialis. So, supinated, midway between supinated and pronated position. And as the patient, sir, I want you to bend your elbows. See, bend. Bend. See, bend. Kani siyang ligawas. That would now be your brachioradialis.
Halfway.
Brachioradialis ni siyang ligawas. Here. That would be your brachioradialis. And next, so we finished that. Okay, let's proceed further sa imong radial-ulnar mga motion. Pronation, supination. Okay, so your pronator teres. So pronator teres, na-identify nyo. So as the patient, sir, I want you to turn your hand so that the palm of the hand will be facing downward, pronated. Then you're going to resist the action. Then you're going to palpate it here. Pronator teres mo na siya. Nag-anak mo ng muscle. So palpate it there. So that would now be your pronator teres. Pronator teres here. Okay. And next, just have this one. First, try to oppose your little finger and your thumb and slightly bend your wrist. You can find a certain tendon yung more ni protrude. Slightly bend and then protrude. Seen that one? So that would now be your palmaris longus. Okay, that would be your palmaris longus. So ito nga, kanag yung ni protrude, ni gawas, yung tendon. So you have your palmaris longus. Okay, so lateral to your palmaris longus, you have your, at the levels of the thumb, you have your flexor carpi radialis. Medial, you have your ulnaris. So how to palpate for your radialis? So ask the patient, sir, I want you to bend, dili ko nota sa taas. Okay, sir, I want you to bend your wrist. Then it's more radially deviated gamay. Then resist that one. So kaning tendon, kaning tendon ni gawas. So that would now be your flexor carpi radialis. Here, flexor carpi radialis. Okay, next, flexor carpi ulnaris. So sir, I still also want you to bend your wrist. And against my resistance there. Kani siyang nigahi, kani siyang tendon there. Level sa little finger. That would now be your flexor carpi ulnaris. Kita mo dyan, stikod. Flexor carpi ulnaris. Okay. So you have your tendon here, tendon there. And try to feel between these mga tendons na kay ulnaris, radialis, palmaris longus. Between these three tendon, you can palpate again for certain tendon here. So that is for your flexor digitorum superficialis. So as the patient, sir, I would just want you to bend your finger there, niya, palpate it there. So manggahi na siya. Okay? Or for your flexor digitorum superficialis, ask the patient to bend the DIP joint. Resist that one. So PIP joint, mami siya. So PIP bend, resist that one. See, bend, curl your hand niya. Palpate it here. Sa imong proximal pala. So inig-bend niya. Bend. Dali niya, palpate. Here. Ang imong flexor digitorum superficialis. Inyong i-resist. Resist that one, no? And then palpate it here. And there mo siya ma-insert to your middle phalanx. So, muangi pa siya. So, at the side. Okay, next for your flexor digitorum profundus. So, deep mo na siya ng muscle. You just bend your tip of the finger there with resistance, and where you're going to palpate it here. Ito siya. Sa middle phalanx. The center. Nasa center. Kaya maum na tendon eh. So, nasa center bend. So, you're going to palpate it here. Resist that one. Palpate it here. Center. So, flexor digitorum profundus. Okay, for your flexor digitorum, flexor pollicis longus. So, flexor pollicis longus, still the same as the patient to bend the thumb. To bend the thumb. So, see the tip there. And then, palpate it here. Modern ang inyong tendon. Try to bend your thumb and try to palpate na yung gahi siya na tendon. So, proximal phalanx. So, that would now be your flexor pollicis longus. Okay. Next. So, let's move on to the extensor carpi radialis longus. So, what you're going to do, just as the patient in this position, pronated, try to raise your hand going towards the ceiling, but pronated. Then, your palpation would be place your levels sa second metacarpal for the longus. Wrist meniscus would be more proximal to the wrist as the patient says, sir, I want you to raise your hand, raise there, and palpate it at that area. So, that would be for your longus. For your brevis, levels sa third metacarpal. Levels sa third metacarpal, palpate that one, sir. Again, raise your hand, wrist, palpate it there. So that would be your extensor carpi radialis brevis. Extensor digitorum, as the patient just to spread the finger, spread. Then, here you now have this tendon. Kaning mga tendon. So those are the tendon for extensor digitorum. You can resist that one. Claro. So you have the tendon there. Muscle belly would be diri man tendon. So muscle belly can be palpated here. Okay. The next, extensor carpi ulnaris. So as the patient again to extend but slightly ulnarly deviate, and then palpate it on the ulnar side. Palpate it here. So extend, then ulnarly deviate, then palpate it this side. Okay, kaning ni gawas. Kaning ni gawas na ko. So that would now be your extensor carpi ulnaris. There. Next, your supinator. So supinator muscle. Supinator, so just as a patient to face the palm of your hand, sir, towards the ceiling. Try to turn your hand so that the palm of the hand will be facing towards the ceiling. You turn, you resist, cut, you sir, move, resist, okay, move, resist, then palpate it here sa head of the radius. Levels head of the radius. So, di ka mo palpate. So, while moving that one, then palpate for the muscle there in back. Here, so that would be your supinator. Okay, next, for your muscle there towards the thumb, extensor. Okay, you can probably do that way. Na siya. Kita mo na po. Okay, this one here, yan yung position. Snap back mo siya. This one will be your extensor pollicis longus, yung tendon. Ano siya? Below here, you have two tendons here, diba? So this tendon now would be for your, in the lowermost would be your abductor pollicis longus. And then more a little bit nasa ibabaw, that would now be your extensor pollicis brevis. So mano siya, i-extend yun there. So as the patient to move the thumb or extend the thumb, so magawas na din siya mga tendon there. Or abduct. The abduction. Palpate. Okay, next. Okay, let's move on to this. There is your hand. So you have here, as we mentioned, you have key muscles here, diba? Your tender eminence. So let's just discuss first this two. Okay, you have your flexor pollicis brevis. So may kanya man siya. Flexor ni, abductor ni, diba? So as the patient, okay sir, I want you to move your thumb across your palm. Okay, across your palm niya. Resist that one. Resist lang. Palpate it there. Yan. Back. Here. So that would be your flexor pollicis brevis. Back. Abductor. Sir, I want you to move your thumb away from your other fingers. Move it away. And resist that one. Palpate it there. So that would now be your abductor pollicis brevis. Back. Okay, let's move next. Adductor pollicis attack. Okay, sir, I want you to move your thumb towards your index or your index fingers. Okay, move there. So palpate it here. So you have your adductor pollicis. Ito na yung adductor pollicis. Ito sa model inyong na-identify din ang muscle. So diyan inyong i-palpate. Adductor pollicis. Back. Here. Next, you have here your little finger. Again, you have two muscles. So for your flexor, so as a patient, sir, I want you to bend your little finger. Bend, resist that one, palpate it there, more inner. So flexor, digiti, minimi. And then, sir, I want you to move your little finger away from your ring fingers. You move, you can resist that one. And palpate it here, you have your little bit lateral, you have your abductor digiti minimi. Ha. Okay, for your opponents, sa duha ka muscle, you can ask the patient to oppose the thumb and the little finger. Oppose it, sir. Imong i-resist, right? Murang imong buhagon ang duha. Then where are you going to palpate? Here at the side, more on the side. When ipabbuhat nimo, palpate nimo would be more at the side. Side here, side there, side here. So you have your opponents on the thumb, opponents pollicis, then the little finger, opponents digiti minimi. Okay, clear? Sige. Try to review again until 3 o'clock.